Good evening. Greetings, everyone. This is your anxiety nurse again, Lawrence. So, for today, we are going to discuss about insomnia because this is the most common general sleep disorders that we need to discuss and focus on in order to address our common anxiety symptoms, which is difficulty in sleeping. So I invite you again, guys, to my channel and please subscribe if you haven't yet subscribed to my channel. And then you can also check my Facebook page for more information. So thank you again, guys, and hope you learned something today. Next slide. So understanding insomnia. This is our topic for today. And before I discuss to you what is insomnia, first, I want to discuss you one of the most important topic or knowledge that you should have in order to understand this particular sleep disorder. So, first, let us discuss sleep. So, our sleep accounts for 1/4 to 1/3 of the human lifespan. Sleep is a vital neglected component of every person's overall health and well-being. It is important for our tissue repair, brain plasticity, or the ability of our brain to learn new inputs and our hormonal and complex bodily function. So there are two stages of sleep, but since we are not going to discuss that further because I like to focus on more terms and knowledge that are necessary for us to understand in dealing this with uh, problem. So before we proceed, this is the most important topic that I want you to be familiarized with. So the term circadian rhythm. So sleep is regulated by our circadian rhythm. All animals, plants, humans, and every cells and physiological function in our body has this rhythm. This is a 24 cycle, a rhythm that follows our everyday routine and life. So this is rhythm are said to reset by exposure to light and darkness. And of course, body temperature. It directly affects our metabolism, thereby affecting our hormones and neurotransmitter in the process. So what do I mean by this? Hormones like cortisol and melatonin are linked to our circadian rhythm. Their production may decrease or increase depending of the time in the day. And these things are necessary for sleep, energy, and mood. To discuss this, at the start of the day, as you can see here and notice at our when you look at to our diagram here, when you are exposed to sunlight, probably at 6 a.m., but it depends on the time zone where you live in. So, for example, at 6 a.m., you are exposed to sunlight, your brain starts to decrease the secretion of melatonin. And then, as time goes by, as the day march on, your body will increase the secretion of the cortisol. So, this is needed in order to give you a sudden boost in energy in order to be more productive throughout the day. So, cortisol will also make your blood pressure rise or increase. Then it will energize your body. So, to prepare you for more important things throughout the day. So, as you can see here, you can notice the time. And then when the darkness sets in, it increases our body temperature, as you can see here, and increases our melatonin production again. So this melatonin hormone is important and helps regulate our sleep and wake cycle. So thereby making us tired throughout the night and preparing our body to relax and to sleep. Then the cycle repeats again. So circadian rhythm, I want you to familiarize yourself with this. So baby doesn't have this circadian rhythm. That is also I want you to know. So during the start of our life, we don't have this kind of rhythm and only matures during adulthood, because during the teenage years, we tend to have erratic rhythm caused by puberty or our hormonal changes in the body. That's why a lot of people tend to have erratic sleep pattern and have more energy throughout the day, even if it is night. So, important thing, no? We will discuss about what causes or affect this cycle. So, when people who overworks, stress, or lack of exposure to sunlight, and who lives in a country where seasons keep on changing, such as in Japan, we have 4 seasons here, and in Canada and other parts of the country. This also affects people who travel a lot because of the sudden change of time zone, like pilot, stewardess, and then delegated officials who travels also a lot. And people who work shifts like doctors, nurses, and call center agent, and so on. So it also affects those who have mental health condition, head injury, brain damage, and dementia. Because remember, our brain is the command center of our body. It regulates hormones and neurotransmitters. So it also explains when we have brain injury, this will have this will have an effect in our circadian rhythm, in our mental health, and in our sleep pattern. So circadian rhythm is directly related to our sleep cycle, sleep, wake, and cycle. So remember that. So treatments and management. Let's proceed. So these are the follow set of routine that we have to follow in order to maintain our healthy cycle. So number one, from the word itself, follow set of routine. So you should wake up and sleep at the same time every day. So diet also is also important, and then sleep supportive environment. So your mattress should be just fine, not too hard, not too soft, and the temperature must be also set into conducive body temperature, a body room temperature in order to help your body relax. So the lightning darkness balance, you should also take care of the curtains and the ventilation of your room. So avoid naps in the late afternoon because it can distract your melatonin hormone rhythm. So as we have discussed before in the past diagram, on the previous diagram, you can where you can remember the circadian rhythm. It is a rhythm that must be followed throughout the day. So when you keep on sleeping erratically, it will affect some of your bodily processes and hormonal changes. It can affect the hormonal changes, making you um, awake at night. And then, of course, you should avoid nicotine, alcohol, and caffeine, because this also have directly effect on our stress response in our body. It keeps you energized and unable to sleep if if this lifestyle is practiced, especially when you are going to sleep. So we should exercise each day. Please do not use cell phone at bedtime. Why? Because as I have discussed before, our sleep wake cycle is regulated by light and darkness. So when you are on the bed, um, what do you call this? Trying to get some rest and sleep, as your melatonin is starting to increase because of the darkness in your room, then you look at your cell phone, turn on the lights, turn on the TV. That lights will affect your melatonin secretion, because your brain will tells that, oh, it's bright, so let's decrease the secretion of melatonin, thereby making you unable to sleep. So we have to remember this, um, and we have to be careful about this practice. So reading books is okay in a dim light, but cell phone, they have this kind of blue light that make us awake and affect our hormonal um, balance, especially the melatonin that is responsible in making us tired and sleepy. So the most common question that I always receive and have been asked is coffee and energy drinks are bad, especially early in the morning? So if you can remember, as I explained before, caffeine interferes with your cortisol production, thereby making it less likely to be the source of our energy and make our body dependent on the caffeine. So instead of your body will rely on your cortisol secretion, making you energized throughout the day, your body will borrow and borrow energy and power from the caffeine, making you dependent on it. So this is just a logical thinking, no, not a very research-based phenomenon. But still, having this kind of logic, we should at least try to consider that taking caffeinated drinks must be or can be helpful if we take it at least during the lunchtime or after lunch, so as not to disturb the circadian cycle, if we are going to think it logically anyway. But of course, it is your decision. But moving on, since we are able to understand some of the concept about sleep and how it helps, how circadian helps our body, now we will discuss insomnia. So yes, so having explained all of these things, we are informed and knowledgeable about our sleep cycle, and the disruption of this can cause insomnia, of course, mood disorders, diabetes, heart disease, and so on. So circadian rhythm can really play a role in our mental health. So next, insomnia. Insomnia is a problem of sleeping or staying asleep, or even both. So it is not just because you are having trouble sleeping or slumbering that is insomnia, no? Sometimes when you have interrupted sleep, and then when you wake up early in the morning and you can get back to sleep, that is also insomnia, no? So however, this is not the only indicator, because a person needs to have daytime symptoms. So, like daytime impairments such as sleepiness or difficulty concentrating, that affects your mood all throughout the day. So there are peoples who are short sleepers, so they don't have this kind of daytime symptoms. So of course, the doctor's evaluation is still needed. But of course, for those who have daytime symptoms, those people can might be suffering from insomnia compared to those people who can function um, with no problems throughout the day, regardless of their numbers of sleep or their sleep. No, because I want also to tell you this, that insomnia is more of is a problem more of the quality of sleep rather than the quantity of sleep. So no matter how long you sleep, it doesn't matter. If you feel like you are not getting enough sleep and your body cannot get energized after sleep, then it's most probably an insomnia, because that is the problem of the sleep quality rather than the problem of sleep quantity. Not the time of your sleep, but the quality of your sleep. So please remember that. So many factors may contribute to insomnia, including stress, medications, and an individual's sleep habits. And of course, environment, because we have discussed that environment can play an important role in regulating our sleep wake cycle. It has also been said that if insomnia goes untreated, it can lead to long term sleep deprivation. And this is linked with a number of harmful effects, including lower quality of life and increased risk for substance abuse, heart diseases, and diabetes. But it is also important to know that occasional sleepless nights are not the same with insomnia. So please, before you panic, always consult your doctor first before Dr. Google, okay? So let's proceed. So there are two types of insomnia: primary insomnia and secondary insomnia. So what is primary insomnia? It means that your sleep problems aren't linked to any other health condition or problem. So among the two, secondary insomnia is the most common types of insomnia, because primary insomnia can be an idiopathic in nature, meaning to say that aside from brain chemistry reasons, no, you don't have a definitive cause or cause and effect that can be attributed to your sleep problems. So secondary insomnia, this means you have trouble sleeping because of a health condition like asthma, allergies, depression, arthritis, cancer, heartburn, I mean, or pain, especially pain, or sometimes substance abuse like alcohol. Alcohol won't help you sleep, so I will just address this. Alcohol can disrupt your sleep quality, thereby, as I've said earlier, insomnia is more of a problem of sleep quality, and thereby alcohol being a substance that can disrupt your quality of sleep, it can cause insomnia. And then let's proceed. Okay. Mhm. By the way, regardless of these types of insomnia, no, we also have that insomnia nature, chronic or acute. When you say acute, it can be a cause of sudden events like death of a loved one, breakup, divorce, exam, exam stress, I mean, and other short-term life situations. And it often resolves and lasts less than 3 months or so. But if it becomes chronic, it can cause psychological impact, or most likely a psychological causes. If it persists over the period of 3 months and can affect your daytime functions at least 3 times a week, then your doctor may classify this or your situation as having chronic insomnia. So let's discuss the traits or characteristic of insomnia. Okay, number one trait would be our difficulty of falling asleep. This is common to all of us. And then we are having problems in sleeping. We cannot slumber off. Then midnight awakening insomnia, number two. And number three, early awakening insomnia. So as you can see, there is a time, no? At 2 a.m. and 3 a.m., between this time, it can be called midnight awakening insomnia. And then 4 o'clock or so, especially if you set your alarm at 7 o'clock, then you are waking between 4 to 5, then that is early awakening insomnia. But of course, it is an evaluation from your doctor is needed before self-diagnosing yourself, because as we have explained before, we also have the called circadian rhythm that affects our body and sleep-wake cycle regardless whether we have the disease or not, or sleep disorders like insomnia or not. And then deep sleep disturbance. Even if you sleep 10 hours, 12 hours, you don't feel energized. So this is a problem in sleep quality. So as you can see, the number one is often called sleep onset insomnia. You cannot sleep, so it is a sleep onset insomnia, while number two and three are classified as sleep maintenance insomnia. You cannot maintain your sleep. And this number four, deep sleep disturbance, can be classified as those who have underlying cause of sleep disorders such as narcolepsy and sleep apnea. So we will discuss this again in detail in our next lecture, probably on our next lecture. So we won't be discussing this tonight or today. So proceed, let's proceed. This is also important, no? The next topic is symptoms of insomnia. So as you can see here, so I've listed those symptoms. It is you please be familiarize yourself with here, because it is the most common daytime symptoms that you uh, probably are suffering as of the moment. So trouble falling asleep, trouble staying asleep, unwanted early morning, waking. So this please, if you have time, try to look at the list and please read this, and let's see, examine yourself if you are experiencing some of these symptoms. But of course, it is not only limited to all these symptoms, no, the insomnia symptoms. What I mean is that, of course, everyone is different, but of course, this is the most common um, problems that we can see in people who are suffering from sleep disorders. So I just want to explain this particular symptoms, no, sleepiness, because sleepiness can cause accidents and problem not only in ourself or in our daily life, but we can also inflict injury to others, especially when we are driving. So it is very important to understand so as to not cause unnecessary accidents for yourself and for others also. The next, causes of sleep problems. So there are also specific sleep disorders that causes these symptoms. Since insomnia is often a secondary cause, just as I said before, rather than a primary cause alone, now we have different kinds of problem that affect this. So this will be discussed on different time, but I just want to make it simple. So sleep environment, we have also explained this during our circadian rhythm. So it is related if as you can remember, if you can remember, no, psychological factors, physical illness like hormonal or pain, alcohol use and drug use. Okay, this is also very important to remember. Mental disorder, just like I've said, like dementia and brain injury during circadian rhythm explanation. Work-related lifestyle, such as call center agent, nurses, and doctors. So you see the relation. That's why I have explained to you first the sleep and circadian rhythm because they are related. If you were able to follow and understand what I'm trying to point and explain to you up to now, so you can see that these sleep problems are also directly related to your sleep circadian rhythm issues. So of course, when you are having problem in sleeping, you have to examine your sleep environment or psychological factors, whether you have anxiety disorders, depression, or stress, high stress as of the moment. Then physical illness, like if you are having menopausal symptoms or pain because of cancer or injury. Then alcohol use and drug use, this includes recreational drug use. So please avoid that. Mental disorders such as schizophrenia and other related bipolar disorders. I mean, that can also cause insomnia. No? Work-related lifestyle, if you are a nurses, doctor who work on shift, as well as call center agent. So let's proceed. Treatment of insomnia. We have cognitive behavioral for insomnia. So experts consider cognitive behavioral therapy for insomnia to be the best, not medication. Most effective initial treatment for chronic insomnia, because chronic insomnia is a psychological issues. So CBTI helps people manage anxiety. They feel about their sleep issues and establish better sleep habits. And then as if you are listening to my other lecture, I've been telling you the importance of cognitive behavioral therapy or psychotherapy. This is the gold standard treatment for any mental health disorders. Of course, in combination with your medications, but CBT is an important part of your recovery. So, sleep medications. If a person experiences significant symptoms from insomnia, or in cases where CBTI does not help immediately, medication may be recommended. So, medication can help promote sleep but may also come with side effects. So, please be careful, such as daytime drowsiness, lightheadedness, or confusion that can lead or result in fall or vehicular accident. So other treatments include melatonin, dietary supplements, yoga, meditation, hypnosis, and aromatherapy. However, scientific evidence supporting the use of these methods to treat insomnia is still lacking at this time. So please be aware and always consult your therapist and doctor before relying too much on these alternative treatments. So CBTI, and what are the most important aspect that can help us and we must remember in dealing with insomnia? It is the called lifestyle and behavioral changes. So, what is that? Sleep hygiene. This is the most important thing that I advise you to please familiarize yourself and memorize. So, maintaining the same bedtime and wake time every day, even on weekends. So, do you remember? Can you still remember what I've said earlier? during the previous slide, that you must need to follow a set of routine. So you can relate it here. You must maintain your circadian rhythm, reserving the use of the bed for only intimate relationship or moments with your partner and sleep. So to prevent your brain from associating your bed and your room from any stressful related situations. So you must prevent that from spiraling out of control. So number three, getting out of bed if falling asleep is taking too long or causing anxiety. So as I've explained, related here, so your bed should be used only for intimate moments and sleep, not consuming caffeine, alcohol, or nicotine, especially near bedtime. So this is self-explanatory. If you can still remember what I've explained, what I've um, taught you during my previous lecture about sympathetic nervous system and how it affects your stress response cycle. And then keeping the bedroom both dark and quiet. So in order to regulate your sleep wake cycle uh, in a healthy manner, so as not to disrupt your melatonin secretion process. Refraining from watching television or using other electronics before bed. So I know you are already familiarized, already familiar with this. Why the reason behind this advice? Not checking the clock to see how long it is taking to fall asleep. So it makes you stress, makes you more afraid and worried about your sleep. So just rest your body and then try to get some restful sleep without worrying about the numbers of hour of the number of hours you only have to sleep. So that will cause unnecessary worrying on your part. So avoiding eating large meals too close to bedtime, because that will disrupt your digestion processes and makes your body work more harder in order to digest and absorb foods, thereby making you alert and energized throughout the night. So it will make you unable to relax and sleep. So that would be all. Thank you for listening. I hope you learned something and was able to answer some of your questions regarding sleep and insomnia. I hope to see you again on my next video lecture. I hope you can subscribe also and follow my YouTube page and channel. And I hope to be of service to you also in the near future. Thank you so much for supporting and have a nice day. This is your anxiety nurse again, Lawrence.